We spend so much time these days thinking about our physical health, what we eat and how we move.
Absolutely.
And more these days, we're thinking about our mental well-being as well.
Right.
But it got me thinking about somebody like, like Maya.
Okay.
She's going through some pretty big changes in her life right now.
Hmm.
New marriage, new city, because she's working remotely.
Okay.
And she's also caring for her father, who's living with dementia.
Oh, wow.
And she seems to be doing pretty well with everything.
Yeah.
She's trying to eat healthy. She's maybe getting to the gym.
Right.
She's even prioritizing her mental health.
That's good.
But even with all of that,
Mhm.
she's still stressed out. Sleep isn't great.
Yeah.
And she just feels like something's missing.
Makes sense.
It makes you wonder, right?
Yeah, it really does.
What is it?
It makes you wonder if there's something else going on.
Yeah.
I think Maya's situation really highlights something really important that we see in a lot of our sources.
Okay.
We often think of health as just these two separate things, physical and mental,
Yeah.
but maybe there's this other really important area
Yeah.
we're overlooking.
What is that?
We're talking about social health.
Social health.
Yeah.
Okay, so in this deep dive, we're going to be talking all about this missing piece of health,
Right.
social health.
Exactly.
We really want to understand what it is, why it's so important, and how we can improve it.
Yes, and I think the key takeaway here
Yeah.
is that you can be doing all the right things for your physical health.
Yeah.
You can be working out. You can be eating healthy foods.
Yeah.
You can be taking care of your mental health, meditating.
Mm-hmm.
But if you're not paying attention to your social connections,
Right.
you might not be as healthy as you could be.
Okay, so let's define these 3 pillars of health.
Yeah, that's a good idea.
We have physical health, mental health, and social health.
Okay, so physical health is all about how well our bodies are functioning.
Right.
Mental health is about our minds. And social health is about the relationships we have with other people.
Okay, so the sources that we've looked at, they
Right.
really emphasize that you need to have all 3 of these things to be truly healthy.
Absolutely.
Yeah.
You can't just focus on one or two of them.
Okay, so let's talk about just how important this social piece really is.
Yeah.
Because our sources actually describe it as a crisis,
That's true.
a global disconnection.
We're seeing some pretty alarming statistics.
Yeah, like what?
Well, for one in 4 people around the world say they feel lonely.
Wow, 1 in 4.
That's a lot of people.
It's a huge amount of people.
It is a huge amount.
That's crazy.
And it gets even worse.
Oh, no.
About 20% of adults around the world
Wow.
say they don't have a single person they can count on when they need help.
Not one person.
Not one.
That's really sad.
It is really sad, and I think it's something that we need to pay attention to.
Yeah.
Because loneliness isn't just an emotional issue.
Right.
It also has a big impact on our physical health.
Yeah. I mean, it makes sense that it would affect your mental health, but how does it affect your physical health?
Well, the research shows that there's a strong link between feeling disconnected and having serious health problems.
Yeah.
Things like stroke, heart disease, diabetes,
Yeah.
dementia, depression,
Oh, wow.
and even premature death.
It's crazy to think that feeling lonely could actually make you die sooner.
It is surprising,
Hmm.
but that's what the science is showing us.
So how does that work?
Well, basically, loneliness acts like a constant stress on your body.
Okay.
And we know that chronic stress can weaken your immune system
Yeah.
and make it harder for your body to fight off disease.
So it's not just in your head.
No, it's not just in your head.
Loneliness is a real physical problem.
Exactly.
Okay, so if that's what happens when we're disconnected, what does it actually mean to be socially healthy?
That's a great question.
What does that look like?
Well, it's definitely more than just having a lot of friends on Facebook
Right.
or followers on Instagram.
Not about the numbers.
It's not about the numbers.
So what is it about?
It's about having meaningful connections with other people.
Okay.
Our sources make a really important distinction between the quantity and the quality of our social interactions.
Okay. I like that quantity versus quality.
Yeah, so quantity is about how many people we interact with on a regular basis.
Okay.
And quality is about how close we are to those people, how much we trust them,
Right.
and how much support we get from them.
So you need both.
You need both.
You need to interact with a lot of people.
Yeah, even if it's just small interactions like saying hi to your neighbor
Yeah.
or chatting with the cashier at the grocery store.
Mhm.
And you also need to have a few close relationships.
Yeah, where you can really be yourself.
Exactly.
And let your guard down.
Yeah,
That makes sense.
it does. And I think it's helpful to see how this plays out in real life.
Yeah. Give us some examples.
Okay, so one example is Jay.
Okay.
He's a college freshman,
Okay.
and he's really struggling to connect with people.
Oh, that's tough.
It is tough. He's in a new environment,
Yeah.
doesn't know anyone,
He's away from home?
and he's feeling really lonely.
Yeah, I remember those days.
Another example is Serena and Allie.
Okay.
They're parents of young kids,
Okay.
and they're so busy
Oh, yeah.
that they barely have time for themselves.
Let alone other people.
Exactly, and they're really missing their friends,
Yeah.
their social life.
It's tough when you have little kids.
It is tough.
You know, you're just so focused on them that it's easy to let your other relationships slide.
Absolutely.
Okay, and what about Henry?
Henry is a recent retiree,
Okay.
and he's finding it hard to adjust to not working anymore.
Yeah.
He misses the social interaction he had at work,
Mm-hmm.
and he's also spending less time with his family now that he's not going to work every day.
So all three of these people are at different stages of life,
Yeah,
but they're all struggling with social health.
they are.
It really shows that this is something that can affect anyone.
Anyone at any age.
Yeah.
It's not just something that happens to old people
Or young people.
or people who are going through major life changes.
It can happen to anyone.
Exactly.
Okay, so we've seen why social health is so important,
Yeah.
and we've seen some of the challenges that people face.
Hmm.
Now, what can we do about it?
Well, our sources recommend a really practical framework.
Okay.
It's called the 531 guideline.
531? What's that?
It's a simple way to improve your social well-being.
Okay, break it down for me.
Okay, so the first part is to interact with 5 different people each week.
Okay, so that's the 5.
That's the 5.
5 different people.
Yeah, it doesn't have to be anything major.
Like you don't have to go on 5 dates
No.
or anything like that.
No, it can just be small interactions.
Okay.
Like saying hello to your neighbor.
Yeah.
Or chatting with the barista at your coffee shop.
Mm-hmm.
The important thing is to just make an effort to connect with other people.
Okay, and why 5?
Well, the research shows that interacting with a variety of people can really boost our mood
Yeah.
and make us feel more connected to our community.
I guess that makes sense.
Yeah.
You know, if you're just stuck in your own little bubble,
Right.
you're not going to feel very connected to the world around you.
Exactly.
Okay, so that's the 5.
That's the 5.
What's the 3?
The 3 is to strengthen at least 3 close relationships.
Okay, so this is about quality over quantity.
Exactly.
These are the people you can really rely on.
Yeah, the people who make you feel loved and supported.
Your ride or dies.
Yet your writer does.
Your people.
Your people.
Okay, so how do you strengthen those relationships?
Well, it's all about being intentional.
Okay.
Making time for the people who are important to you.
Right.
Reaching out to them regularly.
Yeah.
And just letting them know that you care.
It's so easy to let those relationships slip away,
It is.
especially when you're busy or
Yeah.
stressed.
But it's so important to make the effort.
It is, because those are the relationships that really matter. Okay, so we've got the 5. We've got
Yeah.
the 3. What's
Yeah.
the 1?
The 1 is to spend 1 hour each day.
Wow, an hour.
Yeah, 1 hour.
That seems like a lot.
I know. It might seem like a lot.
Especially these days when everybody's so busy.
Right, but it's really important.
Okay.
This hour is all about meaningful connection.
What does that mean exactly?
Well, the best way to connect with someone is face-to-face.
Yeah.
But we know that's not always possible.
Right.
So it could also be things like a phone call,
Mm-hmm.
a video chat,
Oh,
or
yeah.
even just writing a letter.
Yeah.
The important thing is to be present
Right.
and engaged with the other person.
So no scrolling through social media.
No scrolling through social media.
That doesn't count.
That doesn't count.
Okay, so that's the 531 guideline.
Yep.
It's a really simple framework,
It is.
but it can make a big difference in your social health.
I think so.
And one thing that really struck me about our sources
Yeah.
was that the author actually revealed that Maya, the person we were talking about at the beginning, is actually her.
That's right.
She was talking about herself.
She was.
And I thought that was really interesting because it shows that even someone who's really into health and wellness
Mm-hmm.
can still struggle with social health.
Absolutely. It's not something that only affects certain types of people.
Right. It's something that we all need to be aware of.
Exactly.
Okay, so looking ahead to the future,
Yeah.
what's the vision for social health?
Well, our sources paint a pretty optimistic picture.
Okay.
They imagine a world where social health is just as important as physical health
Okay.
and mental health.
So it would be like we teach kids about physical health In gym class,
Exactly.
we would also teach them about social health.
Yeah, we would teach them how to build strong relationships, how to communicate effectively,
Right.
and how to be good friends.
That's a great idea.
It is a great idea.
And it's not just about education. Our sources also talk about changing the way we design our cities to make them more social.
More conducive to connection.
Exactly. So more parks.
What parks?
More community
Well,
centers.
a community center.
More places where people can come together and interact. And the ultimate goal is to make social health just a normal part of life.
Right.
Like brushing your teeth, they're eating your vegetables.
It would just be something that everyone does.
Without even thinking about it.
That's the dream.
That's a great dream.
It is a great dream.
Okay, so the big takeaway from all of this is that relationships really matter.
They really do.
They're not just nice to have.
No.
They're essential for our health and well-being.
Absolutely.
And the 531 guideline is a great way to start improving your social health.
It's a great starting point.
So interact with at least 5 different people each week. Strengthen at least 3 close relationships and spend 1 hour each day on meaningful connection.
And you know what? While you're thinking about that, I want to leave you with one more thought.
Okay.
How are your current social connections affecting your health? Are they helping you or hurting you?
Interesting.
And what can you do to create a more socially connected community?
That's a good question.
That's something to think about.
It is.
It is.